Subventricular zone irradiation or perihippocampal avoidance. My area of research interest is with respect to hippocampal avoidance, not as much with subventricular zone radiation. And given time limits, I suspect I may run out of time, but I have a few slides at the end with respect to subventricular zone radiation. But in general, I think our preclinical understanding of the adult human brain is that there are two sites of ongoing neurogenesis, the generation of new neurons from a neurostem cell compartment. One site is within the hippocampal dentate gyrus, and the second site is within the subventricular zone of the lateral ventricles. With respect to the subgranular zone of the hippocampal dentate gyrus, we believe that the neurogenesis process is important for memory-related formation, whereas perhaps some early clinical data suggests that neurogenesis within the subventricular zone may be important for gliomogenesis. So let's speak first about the hippocampal dentate gyrus. In general, I'm going to take a step back and discuss some of our understanding of neurocognitive toxicity of whole brain or full cranial irradiation. And for a long time, we've understood it as a late effect occurring up to 1 year after whole brain radiotherapy. We've had a number of studies in the last few years that have suggested that perhaps there may be early effects. This was a phase 3 randomized trial conducted at MD Anderson by Dr. Eric Chang for patients with 1 to 3 brain metastases who were treated with radiosurgery alone versus radiosurgery with whole brain radiotherapy. And their primary endpoint was a memory test called the Hopkins Verbal Learning Test. It's a list learning recall test where patients are asked to memorize a list of 12 items and are asked to recall those items immediately or after a 20-minute delay. And their primary endpoint was at 4 months after treatment. And what they observed was that whole brain radiotherapy, in addition to radiosurgery, was associated with a doubling in the rate of significant decline in HVLT, meaning patients at baseline would remember, say, 10 of the 12 words, but 4 months down the road, approximately 50% of patients would remember 5 of the 12 words as an example of a significant clinical decline. And these results were not without validation in the setting of prophylactic cranial radiation. This is RTOG 0214. It was a phase 3 trial of prophylactic cranial radiation versus observations for patients with locally advanced stage 3 A or B non-small cell lung cancer. The primary endpoint was survival, and unfortunately the study did not complete accrual and did not show a survival benefit. But one of the secondary endpoints was again the Hopkins Verbal Learning Test. And what they observed was that prophylactic cranial radiation was associated with a significant decline in HVLT immediate recalling those words immediately after being told them, and delayed recalling those words up to 20 minutes after being told them, at 3 months and even up to 1 year after PCI. But is that really important? Is this intensive list learning recall memory test really important? Well, we tried to assess that by asking patients about whether they've noticed any decline in their cognitive functioning. So this was a secondary analysis that we conducted of 2 prior prophylactic cranial radiation studies. And we did a meta-analysis and observed that PCI was associated with not just decline in HVLT, but also decline in the patient reporting cognitive function at 6 months and up to 12 months after treatment. And again, this data was not without validation. This was the EORTC study of patients who were treated with radiosurgery or radiosurgery plus whole brain radiotherapy for 1 to 3 brain metastases, and they too observed that whole brain radiotherapy was associated with a decline in patient-reported cognitive functioning up to 12 months.